kindness and compassionate care means to me.
Care to me is compassionate care.
What does compassion mean to us?
Compassionate care is a care you provide to an individual patient with a bit of feeling, so you have the feeling what the patient is feeling. Not using it as a job or a task, taking it as walking the patient's steps or wearing the patient's shoes, as you might say, and providing the care from the patient's experience, from the patient's perception and experience, not.
Compassionate care for me, I think, is being human, being real, being honest, and being, who you truly are, and providing that care with love, respect, and dignity.
Putting yourself into the patient's shoes, taking the time to listen to them, understand their perspective, reflect back what brought you into nursing or midwifery in the first place. And then that brings it all together to spending the time and meeting their needs as an individual.
So being able to listen to what the family members have to say and involve them in their care.
When I think of just the word compassionate, it makes me think that it is like an emotional response where midwives and nurses and how they respond to a patient's suffering. So that should trigger an inspiration to try and help this person in their recovery.
Whenever I care for a patient, I put myself in their position. I feel the stress levels when they got hospitalized. So I do understand their stress.
I always think if this was my mother or this was my father, how would I like them to be treated? Listen, understand, show that you care, and if there's a problem, try and fix it for
them. Kindness. I think an element of kindness and empathy and awareness of what I always say, the human condition.
What compassionate care means to me is always making sure we put ourselves in the patient's place and wanting to be treated with compassion and empathy and understanding.
To me, it's acknowledging not just the illness of the patient, but the person and listening to them.
Okay, as a midwife, I think the care that we give comes from the heart, that we feel for the women, that we embrace all their feelings and listen to their worries and their woes, and then be there for them.
Compassionate care is all about treating people the way we would like to be treated if we're in healthcare. So if I were in hospital, I would expect to be treated with respect. I would expect to be included in decisions. I would expect that people would consider me as a person and not just as a type of operation or a broken bone or something like that.